Hi, and welcome to Columbia Conversations and Curbsides, where I have a brief chat with experts about important medical topics. I'm Dr. Hesu Lo, an endocrinologist here at Columbia, and the thing I love most about working here is that every day I get to work with and learn from renowned leaders in their fields, and I invite you to listen in on these conversations. Today I'm speaking with my colleague, Dr. James Lee. We're talking about how a person who needs surgery might go about finding a surgeon. He offers some great insights, resources, and tips on what makes a surgeon qualified, the value of second opinions, and different communication styles. Dr. Lee is an internationally recognized endocrine surgeon who is the chief of endocrine surgery here and serves as co-director of the multidisciplinary New York Thyroid, Parathyroid, and Adrenal Center here at Columbia. He's one of the highest volume endocrine surgeons in the country and is actively involved in the leadership of endocrine surgery at the national and international level. So, Dr. Lee, what are the different considerations one should make when choosing and finding a surgeon?
That's a great question, Dr. Lowe. I think far and away, the most important thing in picking a surgeon is the experience of the surgeon. And a good surrogate for that is how many of that particular type of operation the surgeon does a year. And that's actually the question that I always tell my friends and family that they should always ask the surgeon. The reason for that is because there's this thing called the volume outcomes relationship. Basically, in a nutshell, it means that the more of a particular type of operation or procedure a surgeon or physician does, the better they are at it and the better the outcomes for the patient. So fewer complications, better chances of success. And so you should never be afraid to ask the surgeon how many of X type of procedure they do a year. If they do a lot of them, if they're very experienced, they'll gladly, happily tell you how many they do. I think that's the most important way to figure out where to get your surgical care.
That was my next question. Is there a place that these numbers are published, or can we research that? Or is it okay to just ask your surgeon about their numbers?
Yeah, definitely. Absolutely. Ask your surgeon. Again, any surgeon who does a lot and considers themselves an expert will gladly tell you how many they do. I've never met a shy surgeon who does not want to brag about how many they do. But there are other surrogate ways of finding out this information. So, for example, depending on the type of disease, for example, cardiothoracic surgeons report all of their cases to a statewide database. And so you can actually look up the surgeons to see how many they do. There are things called centers of excellence. So, for example, in weight loss surgery, bariatric surgery, there are designations called centers of excellence, and surgeons have to demonstrate that they do a certain number of procedures in addition to other infrastructure type things in order to garner that designation. But I think, to your point, Dr. Lowe, just ask. That's the best way to go about it.
How can we be sure that the surgeon is reporting accurately their numbers? Is there a way to verify that, or we really have to take your word for it?
Yeah, it's a really great question. And so you hope that you'll never encounter a surgeon physician who will lie to you about the volume that they do. Sadly, there's not really a good way of confirming with data that number, except for some of those specialties that have database reporting requirements. But having said that, other ways of sort of piecing that together is, number one, always ask your medical team for their recommendations, because usually your medical teams will know who the experts in the area are. Definitely ask friends and family. If you have 3 friends who've had an operation by that surgeon, most likely they do a lot of that type of operation. And then the other thing is, do your research. I always tell people, family and friends, that they should go to Google and see what their Google reviews are. So, for example, if a surgeon has 54 5-star reviews and have very happy patients, that person probably does a lot versus someone who has very few reviews. And again, you have to take all of those pieces of information with a grain of salt, and you have to kind of piece it all together and feel very comfortable with the conclusions you draw.
So while we're talking about numbers, is there a threshold or a magic number to indicate how many of a particular procedure indicates expertise?
Dr. Lowe, you always ask the right questions. And so the short answer to that is no, there's no one magic number for everything. So you have to take into account the relative rarity of the disease or the operation that's being performed. But having said that, there is a ton of research for pretty much every procedure that we do in surgery. There's some paper that kind of sets a threshold based on large databases. For that particular procedure, a surgeon should do over X to be considered experienced. So, for example, in thyroid surgery, a number of groups have studied this, and you should probably do at least 50 to 100 a year to be considered an experienced thyroid surgeon. And what I tell my family and friends is that for most things, if your surgeon's doing over 100 of these cases a year, they're pretty experienced.
That's great. Any other practical considerations about choosing a surgeon, such as location, insurance, accessibility?
Ultimately, I think a lot of those other considerations are going to be very patient dependent. So, certainly insurance is a big one. How convenient the surgeon is to you is also something to throw in there. But all of these kinds of other things, I think you have to factor into your chances of success. So, for example, you may find a surgeon who is a block away from your house who does, like a couple of the particular type of procedure that you're looking for versus a surgeon who does hundreds of that operation who may be a little bit less conveniently located. And you probably want to go to the person who does more just to maximize your chances of success. But again, ultimately, a lot of that stuff depends on the individual.
Great, thanks. Now, for thyroid, does it matter what kind of thyroid issue is being referred to for surgery? For example, thyroid cancer versus a nodular goiter. Does that matter as far as the surgical technique is concerned?
It probably matters less in endocrine diseases like thyroid diseases, as long as you have an experienced surgeon who does a lot of them. Typically, whether cancer or benign disease matters a little bit less. But certainly having a multidisciplinary team of experts taking care of you, I think is very important. So, as you know, in our thyroid center, we have all of the experts who take care of thyroid disease, and we talk periodically about our patients and try and come up with the most ideal comprehensive plan, whether it's cancer or benign disease. And making sure that your surgeon is willing and happily talks to the rest of the medical team just to get a multidisciplinary consensus on how to go forward. I think that's sort of the critical point.
Makes sense. Sounds like, as in all things, communication is very key.
Indeed.
How do you feel about second opinions?
I never discourage patients from getting a second opinion. I think it's great. Ultimately, the patient has to be comfortable with the surgeon that they're choosing. And so if they want to get a second opinion, absolutely go for it. And I don't think any surgeon worth their salt would ever disagree that a patient should get a second opinion if that's what they want. Having said that, if you've gotten opinions from your medical doc saying, this is a surgeon for you, you've talked to friends and family, you have 3 friends who have had their operations with that person, and she does 200 of that operation a year, and you have a great rapport with them in the office, you probably don't need a second opinion. But, again, to each their own.
Makes a lot of sense. Anything else you want to add about the topic?
I think the other thing is surgeons have a little bit of a reputation for maybe not being the best communicators or, the easiest people to talk to. And I hope unfairly so. But it's an important point that in terms of communicating with your surgeon, you want to make sure that your goals of care, what you want out of the treatment, are being heard and being taken into account. So I think being able to communicate with a surgeon is very important, and you have to feel comfortable that you're communicating and talking at the same level. Probably equally important is the communication with the surgeon's team. So their administrative staff, their nursing staff, or their extender staff. You may have less of a strong rapport with the surgeon, but if the nurse practitioner or the nurse or the administrator calls you within 10 minutes every time you leave a message on the machine, that's an important plus in the terms of the communication. And then again, importantly, having the surgeon communicate with the rest of the medical team, but also making sure that you're comfortable with the rest of your medical team, I think is equally important.
Great. I think we all agree that every part of the team is really important, from the surgeon all the way down to the person who schedules your appointments. So couldn't agree more. Thanks so much.
Absolutely. Thanks.